It's time for Access the Experts from the University of Nebraska at Omaha with your host, Brandon Axamit.
Hello and welcome to another edition of Access the Experts on News Channel Nebraska, where every Tuesday and Thursday, University of Nebraska at Omaha faculty members answer today's questions facing our state. Now today we have the pleasure of hearing from Dr. Richard Stacy, who is a professor at UNO's School of Health and Kinesiology. So Dr. Stacy, today's question is, cancer rates over the last 20 years have fallen. What is the contributor to the decrease?
Thank you, Brandon. I'm happy to share some thoughts about factors related to cancer rates and cancer death rates. Incidence rates and death rates due to cancer are certainly on the decline. Not counting deaths due to COVID, cancer is the number 2 killer behind heart disease. 15 to 20 years ago, it appeared as if cancer might overtake heart disease as the nation's number 1 cause of death, but then cancer death rates began to drop also. It seems that early detection and reducing cigarette smoking are the 2 most critical factors. Early detection is the key to increasing cancer survival, and cancer survival is defined as being cancer-free for 5 years after diagnosis. The survival rate now for cancer is about 70% compared to 30% in the 70s and 80s. So 70% of those diagnosed today with cancer will survive for at least 5 years. Lung cancer is the number 1 cancer killer, and cigarette smoking is the number 1 risk. 84% of lung cancer is attributable to cigarette smoking. Smoking rates in the U.S. have decreased sharply in the past few decades. In the 1970s, the rate was about 45%. In 1992, it was down to 22%, and today it's about 13.5%. Smoking rates in Utah, I think, are under 10%. Smoking rates respond to taxation. In New York City, the tax on a pack of cigarettes was $4.85, while in Nebraska, it's 64 cents, plus the $1 federal tax. Smoking rates also respond to restriction of smoking in the workplace. Nebraska's Clean Indoor Air Act was enacted in 2008 and went into effect in 2009. And that stipulates that a person cannot smoke in a building or vehicle where other people work. Lung cancer rates are not lower today because fewer people are smoking today, but because persons either chose not to smoke or quit smoking 20 to 30 years ago or more. And there will be fewer lung cancer deaths decades from now because fewer people are smoking today. In summary, maintaining good health in general, avoiding smoking cigarettes, and following recommendations for early detection will continue to reduce cancer rates and cancer death rates. Thank you very much.
Thank you, Dr. Stacy, for sharing your expertise on the topic. Now, for our viewers at home, we want you to interact with UNO's experts. So if you have a question that you want answered, submit it at newschannelnebraska.com.
Access the Experts, presented by the University of Nebraska at Omaha. If you have questions, submit them on our website. Then join us every Tuesday and Thursdays at 6:46 a.m. and p.m. while we answer your questions.